Namaste. Welcome to Kaivalya Yoga Gurukulam, KYG, for this special video on yoga asanas to help relieve lower back pain. I have a couple of models, and I promise you this won't be long, and it's definitely not an anatomy class, but I want to explain to you very briefly which part of this lower back that we are going to target in today's exercises. When we say back, we have a back that starts from here, the spinal cord starts from here, you have the cervical part of the spine, you have the dorsal part, and here comes the lumbar part, right? And this is where we are going to focus in our exercises today. Most of the lower back problems are relieved when we get flexibility, not only in this part of the body, but all of this part, this whole section that is connected, especially the ball and socket joint. This is where we need to create that. So now, if you can focus here, this is what the discs are. Where does the pain come? It is a L5, L4, 3, 2, and 1. So from L1 to L5, most of the body weight, the upper body weight, is taken by this part, and we see how big they are. So the discs in L5, discs in L4, this soft gel-like substance, they get ruptured, and so either they bulge out, which is called a disc bulge, or they get inflamed, and then these two cartilages begins to press, and so they pinch on these. If you see these nerves coming out, they pinch on these nerves, and that's what causes the pain. Okay, and so let's come to the other model here. So when we talk of why do we hold our hips like this way, we talk of back pain and we hold our hips. Why? Because of this region. So if you see L3, L4, and L5, these are the three parts. So from here, the nerve endings come out. So they go, some of them, like the sciatic nerve, goes all the way down, so you have shooting pain down the leg. So in our exercises today, we are going to focus on this part and create mobility in the ball and socket joint, in our glutes and the muscles, the hamstrings that goes down a little more. So please check out our beginners yoga classes in addition to what you'll learn in this video, because those classes are even more slower paced. And if you're looking for a long-term solution to your lower back, every exercise taught in this class is done with keeping in mind that people could have lower back problem. So please check out those classes for your continued practice. All right, so let's get down to some exercises that you can do on an everyday basis. You can use just this video if you feel comfortable with, and practice those exercises regularly to help relieve. Now, before we go to the exercises, here is a very common sense disclaimer. Yoga approach to lower back pain does not end with just asanas alone. Those asanas will help you get relief, and that is only 25% to 30% of the problem. 70% of your solution lies in lifestyle. And a big part of that lifestyle is diet. If you're going to consume food that causes inflammation, sweets and simple carbs and that kind of stuff, then this kind of relief will be very, very temporary. But nevertheless, it will still provide some relief. So without much ado, let's get to the asanas. All right, so for these exercises, the initial part, all you would need is just a regular chair, a regular folding chair. Okay, I think most of us have this at home. So I'm going to demonstrate how we can do some simple exercises to create that same flexibility in the ball and socket joint, and the focus is bringing flexibility in this back. So you need a chair, and you need a couple of yoga blocks to place it below, or you can even have a stool to place below, because when we lean forward, you need your hand to rest on something. When your hand rests on something, what happens is it relieves the pressure of your lower back. Otherwise, if you try to bend forward like this with your hands not resting on anything, the back gets a lot more pressure. And when you're already having lower back pain, you don't want to add on more. So you can either rest your elbows like this and lean forward, or better still, you can have a stool when we do our exercises. And we're going to start one. So first, sit on the chair. The first things first is In all these exercises, you're not going to sit leaning back on the chair. So you're not going to start exercise doing like this. This is it's counterproductive. So let us sit up tall and straight, number one. Number two is watch my feet. First of all, I'm going to open up my hip and place my feet parallel and knees wide open, as much as I can, possibly can, with my feet pointing straight ahead. Okay, if you take a look at my feet, I don't want my feet going like this. You don't want to sit like this. You want to keep it straight. That enhances the flexibility in the ball and socket joint. So keep your feet straight and open up your knees as much as you can. So this is your starting position. From here, all right, you're going to breathe in and breathe out using your chest. The stomach will be always pulled in. It's like you're wearing a natural belt. You want to keep this part tight. Don't let your stomach lose any part of the exercise, okay? So you're going to pull your stomach in, breathe in and out through the chest. So first sit up tall and straight. If necessary, hold the chair, lengthen the spine, stomach pulled in. Let's breathe in and out a couple of times. Inhale at your own pace and exhale fully. Inhale. Exhale again at your own pace. Use my guidance just as for reference. Okay. Now we are going to bend forward, creating flexibility here. When I say bend forward, watch my back. My back is straight as it goes down. Okay. Now you don't want to do this. You don't want to start bending down like this. Why? Because this is working on the upper part of the body here. You don't want to work there. You want to work on this part. So sit up tall and straight, bending like so. Exhale, come down. Rest your hand on the stool or on the yoga block. Go down as much as you can. Lengthen your spine. See, watch the length of my spine is not compromised. I'm not doing this. So leaning forward, opening up, go as much as you can, creating, so the flexibility in the ball and socket joint is what is happening here. This is getting engaged. Breathe in and out. And come up. Once again, inhale. As you exhale throughout the exercise, keep your stomach pulled in. Breathing all happens here. Keep the prana pushed up and here. So when you pull your stomach in, it's called the Laghu Uddiyana. Maintain the Laghu Uddiyana. Breathe in. As you breathe out, forward stretch. Or rather, it's called the forward fold. Breathe in and out. Stay in this pose. Go as low as you can. Go as low as you can. Watch at any level, back is straight. Don't hunch your back. Straight as you can. Breathe. Breathe. Stomach pulled in. Don't let your stomach fall out. Breathe in, come up. Now, if you can't hold it long, of course, you're going to come up and try again. Now, we're going to go sideways like so. So, inhale. Again, stomach pulled in. As you exhale, go down. Inhale, come up. See, I'm just twisting slightly in the lower back. Exhale, go down the other side. Stomach pulled in. Inhale, come up. Again, exhale, go down. Inhale, come up. We do this as part of yogic kriyas as well, so it also helps in bringing flexibility. Inhale. As you exhale, go down. Again, stomach is pulled in throughout. Inhale, come up. Exhale, go down front, straight down. Inhale, come up. Feet parallel, knees wide apart. Go down. Inhale, come up. So this is your first exercise. You can repeat these sequences as many times as you wish to. But what we did is a good sequence, 3 times forward, and then alternate, do it about 3 to 5 times, and again end up doing 3 times forward, down, and up. All the time stomach pulled in. Okay. The second one is we're going to lean forward like so. It's a little variation from what we did. Now I'm going to take my left elbow and push my left knee out like this. Right hand is on the thigh. Okay? You can rest your elbow if it can on the chair. Otherwise, just keep it like so. So stomach is pulled in. Inhale. And watch. As I exhale, I'm going to twist. Lengthening the spine, I'm going to twist. Again, I'm not doing this. Lengthening the spine, I'm going to twist. So it helps in the lower back. Stomach nicely, tightly pulled in. Breathe in and out in this position. Using your chest to breathe. It'll take a while. Be very patient. It takes a week or 2 weeks to learn how to breathe in these positions. Inhale, come up. Exhale, go down the other side with your right hand. Push the right knee out. Left hand on your left knee. Inhale. As you exhale, twist. Again, try and lengthen the spine. Twist. Breathe in and out. Stomach pulled in. There will be a slight movement in the stomach in and out, but majority of the breathing happens in the lung section. Inhale, come up. This is another exercise. You can repeat again like so. Exhale, twist. Stay there for 2 or 3 breaths. Inhale, come up. So in asanas, what happens is you squeeze and hold the pose there for a little bit so that the blood is squeezed out, and then when you come up, now the muscle is relaxed and is filled with oxygen-rich blood, which begins the healing process. So let's do the other side. Exhale. Stomach pulled in. Inhale, come on. All right. Excellent. So here again, you can repeat this 2 or 3 times, 4 times if you will. Don't overdo it on the first day, but then take it very gentle and slow. Patience and perseverance is all. Patience, slow-paced, and be consistent in all of these exercises. Please check out our beginners yoga classes at KYG. And they're all done at a very slow pace because I'm assuming 9 out of 10 people will have lower back problems. And all those exercises will help you relieve that. So for the third one now, let's go to another variation. For this, I'm going to turn the chair around. It is a chair twist, spinal twist, sitting on the chair. So I sit up like so. My thighs are pushed against the wall of the chair. I'm sitting up again, tall and straight. Stomach is pulled in. So this is the secret and the key to engage your lower back, okay? All the breathing happens here. So mild Uddiyana Bandha. Your right hand, hold the chair, edge like so. Your left hand, this. So with your left hand, you're going to push the left shoulder away, and with the right hand, you're going to pull the right shoulder in. So you're going to create the twist. Now watch happens. I might see this. I'm just exaggerating. So don't lean back. Don't lean forward. Sit up tall and straight. Get to this position. Stomach is pulled in. Inhale. As you exhale with your left hand, push and twist. Twist. Now the neck is very relaxed. You don't have to strain and look to that side. Keep your neck relaxed. Use your shoulder. Watch my shoulder. My shoulder is what moves. Move with the shoulder. Sit up tall and straight. Breathe in and out. Stomach is pulled in. Breathe in and out. Stay here from anywhere from 10 seconds to 30 seconds. Use these videos. Watch this again and again. Practice along till you get the technique perfected. And relax. Wonderful. Let's try the other side. One side might be easier than the other. All of this is natural. Your left hand, your right hand. This time your right hand is going to push so you complete the twist. And the left hand you're going to pull closer. Sit up tall and straight again. Don't lean back like this. Don't lean like so. Stomach pulled in, get into position. Inhale. As you exhale with your right hand, push. Breathe in and out. Stomach pulled in. Hold this pose. You're squeezing the lower back. Like you squeeze a towel after your shower, right? Squeeze. Hold it. Breathe in and out. Hold it as long as you can, comfortably, again 10 to 30 seconds. And relax. So once again, you can repeat this a couple of times, 2 or 3 times, and that will help you relieve the lower back. So these are the 3 exercises that you can do. sitting on the chair. The twist, the leaning forward and twist, and the one that you simply go leaning back and forth, creating mobility, flexibility in the ball and socket joint. Let's stand up. I'm going to keep the chair on one side just for support. I'm going to use this hand for support here. I'll show you another exercise that brings about flexibility here. Again, throughout the exercises, stomach is pulled in. Inhale. As you exhale, you raise your left knee up as high as you can. You inhale. As you exhale, open up the hip. Opening up the hip. So this is for support here. Don't try and balance without support, especially if you have lower back problems, because this helps. Takes the pressure off your lower back. Open up the hip. Now I'm not turning one side. Only the hip is open. Come forward. Relax. Let's try the other side. Stand up tall and straight. Inhale. As you exhale, raise your right knee up. Spine is straight. Standing tall. Watch my back here. My back is straight and tall. If you watch me from the side, you will see I'm standing tall and straight. I'm not doing this. Don't do this. Tall and straight. Knee as high as you can. And then you inhale. As you exhale, open up the hip. The foot on the ground is pointing straight ahead. Open up the hip. Maintain this height. Don't start dropping the knee. Keep it up. Open. Stomach is pulled in. Breathe in and out. And come back. And relax. Excellent. All right. For the next exercise, let me get these blocks out of the way for now. I'm going to turn the chair in front. And I'm going to stand with my feet apart. About 2.5 feet apart. Watch my toes are pointed in either direction. I'm going to hold the chair and go down. Again, opening up the hip. Your knee will tend to come forward a little bit. Try and push your knee as far back as you can. Try and stand as straight as you can. If you start getting catch in your glutes, come up. Relax. Okay, you can shake your legs like so. Again, open up. Watch my feet open completely on either direction here. Okay? Stand up tall and straight. Now you can use your chair for support, but make sure you don't rely too much because you could fall back. So be careful when you do this exercise. But it's an excellent exercise to bring mobility, and really one of the rarely done exercises for lower back. But this really will go a long way in helping you. So open up your feet and gently, again, like I said, patient. Open up your knees. Let your knees not fold forward. Keep it back as straight as you can. Go down. Come up. Relax. Go down again. Slowly. Come up. And then the third time, go down. Stay there for some time. Anywhere from 10 to 30 seconds. Stomach is pulled in. Breathe in and out. Slowly you can move to one side and the other side, little bit at a time. Creating that flexibility, maintaining the position as low as you can, and then come up slowly. Get your feet back, come out, and shake it up a little bit. Like I said, the first couple of days, don't overdo these exercises. Do it gently, and they go a long way in helping to relieve your lower back. All right. Now we'll do a couple of exercises lying down, and that should finish the session. All right. Let's put the chair away. I'm going to lie down. Now for this exercise, we'll need a belt. So grab a yoga belt, and if you don't have one, I strongly suggest you get one. Grab a yoga belt. Stretch your left leg out. Put the belt on the right foot like so. Right hand. Stretch your left hand out. This is the position you want to take. Stomach is again pulled in. You're going to breathe in and out through the chest. Inhale. As you exhale, gently begin to stretch. What we are doing here is we are creating flexibility in the hamstrings. But your lower back is well supported because you're lying down. So it's a very safe way to bring flexibility to your hamstrings. So as straight as you can. If you cannot Straighten your knees, don't worry. Don't force, it will come with practice. This shoulder is relaxed, this whole part of the body is relaxed. Breathe in and out using your chest. Stomach is pulled in. Hold this position. Breathe. Maintain this for 10 or 30 seconds. And then if you can, bend your knee and open up slightly. Opening up again the ball and socket joint. Stretch your leg out or keep your knee bent. Slowly bring this flexibility in and out, little bit at a time. And come back up. Relax. Excellent. Let's do the other side. Put the belt across your left foot like so. Hand is not on the outside, your hand is on the inside. Left hand on the inside of the knee. Stretch your right hand out. This time pull your stomach in. Inhale. As you exhale, straighten. Breathe in and out. Again, you can hold this for 10 to 30 seconds, allowing the hamstrings to stretch. You will feel the stretch in your hamstrings. Knee will be slightly bent. If you are very inflexible, allow that to slowly straighten up with practice. And then open up the hip. When you do this, don't let your butt come off the ground like this. Don't do this. You're opening up the hip. So this part of the body stays grounded. So just a little bit. Again, knee bent. Slowly begin to stretch as much as you can. Stomach is pulled in. Breathe in and out of the chest. Come up slowly and relax. That's it. Just patient, slow practice. Use common sense. Stomach pulled in. Hold on to your knees. Open up the knees. Bring your knees, press them on either side of your torso. Rock side to side. Breathing in and out with the chest. The Laghu Uddiyana is maintained. Rotate your knees in and out. Gently clockwise, counterclockwise. Again, you're creating flexibility in the ball and socket joint. That is the key. The more your hips are flexible, the easier it will be on your lower back. All right, one last one. Knees on the feet on the ground, close to your glutes. Stretch your right hand out. Take your hips to the right side. Bring the knees close to your chest and then turn to the left. With your left hand, press your knees down. Stomach is pulled in. Inhale and exhale. Turn to the right. Breathe in and out. Similar to what we did sitting on the chair. Stomach is pulled in. Again, neck is relaxed. Use your shoulder. And come back. Come to the center again. Stretch your left hand out. Take your hips first to the left side. Bring your knees in. And bring them down to the right. With your right hand, press your knees down. Inhale. As you exhale, pull your stomach in and twist. Breathe in and out. This flexibility will come with practice. Patiently hold it there. And come back. Now it's important that when you do this, don't go straight away like this. Watch out what happens. My shoulder is here, my hip is here. I want it all in straight line. So when you put your right hand out, first move your hip towards the right. Then when you turn, this will be more or less in a straight line. So this alignment, if it's not done, the exercise becomes very less effective. All right, that's pretty much it. Once again, breathing in and out gently. Rotate. And stretch out. That's it, my dear friends. Lie down for a few minutes in peace and quiet. You can gently release the stomach now. Breathe more freely if you wish to, allowing the stomach to go up and down. You can lie here as long as you want, 4 or 5 minutes or so. Then when you get up, turn to one side, rotate to one side gently. Press your palm on the floor, come up with support. Come and sit down. And that's it. These simple exercises will go a long way in helping you relieve the tightness in your lower back. Gently bring in flexibility, increasing the blood circulation. And the more blood flows in and out, the more oxygen, the healing begins to happen. May the divine guide you in these exercises. And before I sign off, one more reminder. Please check out the KYG Yoga Beginners classes. All these classes are very, very slow-paced, taught in a very traditional yogic manner. Thank you for giving me a chance to share this knowledge with you all. Namaste. Have a blessed day.